Welcome back to the Pontio Podcast. In today's episode, we have Craig with us. And in today's episode, we're going to be talking about reaching your full potential as a physiotherapist. Welcome, Craig.
Well, hi everyone. My name's Craig, otherwise known as, Craig the Physio on socials, which kickstarted coming up to a couple of years ago now. So excited to get chatting with Adam.
Perfect. So for anyone who doesn't know who you are, could you just give a brief background to yourself?
Yeah, so essentially, I'm a physiotherapist who's been working for around 3 years within the NHS. And then basically, dip my feet into the water of sports and private sector as well as social media. So essentially graduated in September 2023, went straight into some pitch side work over at a men's team, semi-professional, before starting my band 5 rotations. Basically ended up working as a band 5 for around 10 months before luckily getting onto a developmental 5 to 6 program, where I then became a 6 in just a little bit over a year. And then after that, I just decided to pick up the phone and start recording silly little videos, and here we are.
Brilliant. Perfect. So as I mentioned, today's episode, we're going to be talking about reaching your full potential. What does full potential mean to you?
Oh, I ask that question to myself every day, really, because it changes. I would say full potential, from a clinician standpoint, is different for each person, but on a personal side of things, it's more like putting myself in a space where I feel happy to do what I'm doing. So I always felt like, and that's why we can go into in a little bit, why I left different parts of physiotherapy, because ultimately I wasn't happy, and then I couldn't actually unlock that full potential per se, because I feel like you're working optimally when you're enjoying what you do.
Yeah, bro. So do you think it's more about reflecting on what you want and then having that flexibility to change what you want? Like you mentioned, you say you think about what your potential is every day.
Yeah, I mean, to start off with, I think less so now, because I've got a bit more of a clearer view on things. But as a fresh new grad, I think the best thing you can do is say yes to everything, because the only way you're going to find out is from experiencing it yourself. So rather than, like we had a chat a little bit before regarding going down that side of things of just doing your rotations and following suit to other physios around you, I this is probably the best time to make your mistakes, when you're students or when you're new grads, and then you either be pointed in the right direction from someone more superior, or you fall on your feet and find out, actually, maybe that isn't for me and I'll try something different, really.
Yeah, and is there any like particular opportunities that you would say are more favorable to say yes to, or is that more dependent on the physio?
I mean, the main thing with physiotherapy and healthcare in itself, especially as a new grad, is just understanding your scope. So as long as you're like well aligned with that, and you know you're not maybe potentially overstepping your boundaries and scope by saying yes, I would say definitely in the gap between graduating and actually starting your first job, there's so many voluntary experiences out there, whether that's pitch side at a sport or even being a receptionist at a private clinic. That's what I mean by saying yes to everything, because and nowadays, with how scarce jobs are within physio, you have to show why you're better than the person sat next to you. Um, and you have to be more selfish in the side of things. I would probably say from my side, like I probably could have spent that summer doing a bit more socially, but I kind of went down the thing of, okay, there's other physios that are graduating from around the world, especially in the UK at that time. How am I going to put myself ahead of them?
Yeah, so more about your willingness to show the commitment.
Yeah, and
Yeah,
then the things that, like you said, the opportunities I would say yes to is definitely part-time roles, or mostly voluntary roles, where you can do like sports massage at events. Like there's loads of races going on throughout the summer, in that gap between when people are graduating, or like I said, being a receptionist, or just and being able to shadow different clinicians from different sides of physiotherapy. Especially if you're not quite sure which avenue you want to go down, that's where you have that little bit of a gap, if you do, to go and cast your eyes on some of the best physios around you in that area, really.
yeah, it's really good that you can show like you've been able to show your commitment and push yourself forward. Is there any particular habits that you could pick out from yourself that's helped you to get to where you are at the moment?
I think probably the annoyance of myself. I think when I was a 5, I don't know if they found it annoying or not, but I tried to rub shoulders the best I could with the senior physios. And for a bit of a backstory, where I worked 6 months in outpatients, I knew what my next few rotations were, and in my head, I already knew that I wanted to be an MSK clinician. So by that time, I was planting seeds in the supervisors around me that I wanted to come back, and that I'm not going to go down that route of doing my rotations, and I want to be an MSK clinician. And the quicker I do it, the quicker I can get an experience to then get that sixth role that I want. So from that side of things, yeah, rubbing shoulders, asking questions. Because that's what the supervisors are there for, and the physios around you should be able to guide you in the right direction. I found out that as long as you're asking the right questions at the right time, then they'll give you the perfect answer where they can. But if it's more kind of asking questions and not really giving too much explanation behind, and that's where it can seem like it could be a bit of an annoyance, and that's where I think could be a little bit of annoyance back then. But definitely, I would say, yeah, rubbing shoulders with, and not even just physios, just get chatting with surgeons, other like OTs, nursing staff when you're on the ward. Just if you're happy about how confident you can be as a physio, like you should make it known to the people around you, whether that's in the MDT or other physios as well.
Do you have any advice for anyone who maybe lacks a little bit in that confidence side of things, on how they could build that confidence? Is there any techniques that you have?
Well, I wouldn't say any techniques per se, but I would probably say it just comes from repetition. Like we find with as a physio, and you'll learn that a big thing you hear a lot is like patient mileage. So the more patients you see, the better you understand when you're met with similar scenarios with these patients. And it's the same thing with different clinicians. You're going to come up against either physios at a similar level to you or
Mm.
even superior. And then as you pick up these little tools that you can add to your toolbox, essentially, that's how you can become more confident. I feel like you're probably only ever not confident with something if you're not sure. So if you're not confident in something, whether
Mhm.
that's on placement in an OSCE or on an exam per se, that's where you'd use your clinical educators or tutors from uni, and just to ask them like that, I'm struggling with this, and I don't feel like once I finish university that I'm going to be too confident with it. How can I
Mm.
nip this in the bud here and now, so that when I'm
Mm.
met again with it, how I won't be as scared, or I would feel more confident when met with this sort of obstacle again.
That's really good. And with your habits, on how your habits to progress and helping you progress, have they changed at all as you like now you're in band six role?
Yeah, do you know what? It's probably a bit more difficult now because I guess the trajectory is slightly different. Well, in my hospital anyway, where the sevens have been about for a while and some of them don't look like they're going anywhere. So
Mm.
it's a bit more difficult now because obviously as a band six, you're expected to be senior across different parts in MSK. So where I would have gone through like lower limb, upper limb, spinal, and hydrotherapy, you're meant to have a good knowledge base in all those regions. But then the next step up is then okay, now you've got to specialize in one of those. And
Mm.
what's different from the band five rotations, like you can grow into, I think, into a six role, but into a seven, you're then going to be I guess a specialist in that area, and people are going to turn towards you. So I think I definitely need to brush up more on some CPD, and I think they're a bit harder to come by potentially when you're the higher up you go because they're a bit more specific. So that's what I'd say. Yeah, I think that's probably a good reminder for myself to keep brushing up on my CPD.
And out of interest, how do you find your CPD at the moment?
Well, I think your trust should be quite good in giving out funding, and they should be definitely, or you should be pushing them to try and get you on some sort
Mm.
of course every quarter, I would say. But that doesn't mean that you can't go out of your way and look on like the CPD website, or there's a few other um, places like Physio Network. They've got loads of online masterclasses, which are brilliant. So you don't even have to leave your room to build up your knowledge base. Off the top of my head, I can't quite think of any others. I think Physio Tutors also have some other online ones, but literally just popping it into Google and just having a bit of a search, find something that you're either interested in, that's how you want to build yourself as a clinician, or actually think, oh, I'm not very like, confident with that, and I should probably go and have a look at that just to help sharpen the knife.
Yeah. And I know obviously you're in that process now of trying to keep learning and using obviously these CPD websites and opportunities to help develop into the next stage. So this question's obviously a bit hard because it's not going to be as reflective. But is there any tips for any students or early career physios that are feeling a little bit overwhelmed of all the information that they have available to them to help progress? So, like you mentioned, Physio Network, they have great resources out there, but a lot of resources, and that feeling of overwhelm can come quite quickly. Is there anything that you find helps dealing with that?
Yeah, I would say basically just sort of I would want to understand more about what helped with me, sorry, was understanding my why and my interests. Okay, like why why am I doing this job that I want to do, and why do I want to now change to a different role? Doing
Hmm.
everything and anything and everything in terms of CPD won't always be too helpful if they're very sparse. So I think that's a question you have to ask yourself is what where am I going with my career, or where do I want to go with it? If you think, okay, I know that my next rotation might be on a respiratory ward, I should probably start looking in around that sort of CPD. Or
Hmm.
actually, I'm going to be sniffing about for some MSK roles. Let's polish that up so then I know when it comes interview day or when I can apply that I can answer those questions. So I would say mainly bringing it back to what you want to do before looking out at different courses,
And
and that would
how do you
definitely
know?
help.
And how do you know you're progressing? Is that too hard to answer?
The best, no, absolutely not. No, the best way for you to know whether you're progressing or not is you'll see every day the um irrelevant of what sort of setting you're in, whether your patient's getting better, the feedback you're getting from them, you should be getting feedback from your supervisor, and if you're not, you should challenge that, both positive and negative, because you can't grow otherwise. Um, and as well as that, you're going to be met with scenarios, whether it's with a neuro patient or whether it's with like a CVR patient or an MSK patient. You're
Mhm.
seeing these patients over a period of time, and once they're discharged, the likelihood you're going to see another similar patient with quite a similar background or pathology, and you'll just feel more confident, and things will just click a bit quicker when you come to treating it.
Yeah, and has that changed at all since you've graduated, in terms of like the feedback, the types of feedback you've been given?
I think absolutely, because the main thing, because I'm a practice educator myself, the main thing we look at with students, especially from like a year one to a year three, or if it's any more than that, essentially, we just want students to be safe and just to make sure that they're maintaining professionalism. That's more for like your year one to twos, and then we're then looking to see, okay, now as you're a third year physio, we're looking to see, okay, you're starting to think a bit more like a band five. And that's where I guess then that's where we're trying to see, okay, how does the thinking sort of change with that? And from your to answer to your question, yes, it's very different because from a student, I think it's you're going to be assessed slightly differently because it's like a sheet of paper that you're getting marked off of at
Mm.
the end of it with your CPAP forms compared to a physio, you're seeing real life patients with real life conditions. That's the difference between how to know whether you're progressing and things like that.
And would you have changed anything that you did when you were first in that year one, year two role?
Oh, absolutely. I think if I had the resources that we have now, I'd be potentially twice the better student I was, sorry. Partially because I relied heavily too much on like the lectures and I guess my classmates, and I didn't look online near enough as I should have. And I think that probably would have saved some stress and anxiety when it came exam season. So I think where physio itself is ever evolving and as well as what research is coming out, we should be leaning on it because although your exams can be quite similar when you're treating actual people, you have to keep up to date with the evidence base. So keep tapping into that because I know for a fact some lecturers might be slightly older school, others more modern. So as long as you can tap in between the two and just keep in touch with the evidence base, you'll be absolutely fine.
Yeah. Do you have like a schedule out of interest in terms of your own CPD and then like, using the online resources? Do you have a timetable in terms of when you're going to use it, how long you're going to use it for, what you're going to look at, that sort of
I,
thing?
I personally don't, but you absolutely should, especially when you've got a bit more time on your hands. as I've got fingers in pies at the moment, but I definitely think as a new grad physio, you're just thinking about, okay, how can I quickly add tools to my toolbox,
Hmm.
and the most valuable ones as well. So in terms of framework, I would say if you can, in terms of what we've got at the moment, you should be having a look at the research at least once a week, whether that's a paper or or a podcast or a book, anything like that. I would say I don't personally do it, but I think that would be beneficial and it would make you a better clinician. At least once a week with that. Try and get on some sort of CPD every 2-3 months, whether that's sort of if you have the capacity to self-fund, or if the uni or trust that you have a placement on or working at can facilitate that. But yeah, I would say in terms of things that you can read online, everyone's known to doom scroll. We can probably make it a bit more beneficial with what we're consuming, rather than what's online. We could kind of specify making it more physio orientated.
Yeah. And is there a particular type of CPD that you find most beneficial for yourself? So if it's like an online structured course, or if it's maybe more of a like a networking event, is there anything that you find most beneficial?
This is just for me, but I love a face to face, partially just because I just absorb the content a lot better. I feel like I'll be quick to switch off when it's online. But when you're out there meeting other sort of physios and physio students, you kind of owe it to yourself to kind of stay switched on, especially when it's face to face, and you just get challenged a bit more. And I mean, physio is going towards that more virtual side of things, but I like seeing things in front of me, and I think that's definitely how I pick things up a lot quicker. But not to say that the others aren't equally as beneficial for someone else.
No, I totally agree with you in terms of being in person. You just engage that a little bit more, don't you? Yeah, it's interesting because online resources are becoming much more available to students, but it's like being able to use it correctly. Because I go back to that feeling, what I mentioned earlier, that feeling of being overwhelmed is something
Mm,
that comes up again and again when I talk to other students.
mm.
It's just being able to cherry pick the right opportunities and right resources um for the specific physio or student.
Yeah,
Yeah,
I think something to go off is what we go through with our students is like a must, could, should format. So when you're
yeah,
treating patients, I don't know if you've heard it yourself, but you need to rule out any of the nasties with your red flag questioning or serious pathologies. Then you should, for example, look at your objective testing and subjective testing throughout that, whether it's that range of motion, strength, etc. And then you could maybe try a different treatment adjunct or modality that you've seen online. But I would say if you're doing on placement, just check in with your supervisor. Because if you're trying a graded MOB that you're maybe not too comfortable with and you've only really seen it online, just check in with your supervisor and they'll probably be more than happy for you to use it if they think it's beneficial.
Okay, so we're going to move on to the quick fire question round now, just to
Okay.
finish up the podcast. If that's okay.
Yep.
Perfect. So, first of all, one word that describes a great physio.
Or I don't want to say empathetic because I feel like everyone's going to say that. It's going to have a hyphen in it, and we're going to go open-minded.
One habit every physio should build.
Uh, I think uh, it's going to be scoped slightly differently, but be clinically annoying with your supervisors around you. As in, by that I mean trying to keep develop however you can.
One habit every physio should break.
Oh, using the same exercises over and over, you have to open up your scope. And that goes across all sorts of physio. Don't just use the same treatment and assessment structure. Be open-minded, like I said earlier, and open that up.
Best investment you've ever made in yourself.
Oh, that's quite a different one. Do you know what? I didn't even buy it, but just literally starting social media has just opened doors and spoken to so many amazing people, both clinicians and students, and it's really that's brought back the why into being a physio, I would say.
Biggest mistake young physios tend to make.
I think it's like the fear of failure, the being scared to do wrong when we expect physios to make mistakes, and that's the best time to do it, because I'd rather you do it now whilst you're learning rather than years down the line when you didn't ask a question.
A skill every physio should master.
Oh, communication. I feel like you can be so book smart, but if you can't hold a conversation with your patients, you're going to struggle big time.
Yeah. One thing every physio should stop worrying about.
That's what I should stop worrying about. I would say stop worrying about what's happening in the future and try things now.
And finally, one thing every physio should start doing tomorrow.
One thing they can start doing tomorrow. Get online and start absorbing as much physio-based content as you can, because it's just going to help add to the toolbox and shape you into the clinician that you want to become.
Perfect. Well, thank you, Craig, for joining today. I really
Thank you,
appreciate it.
Adam.
Yeah, brilliant. See you later.